Broadcasting live from the North Fulton Business RadioX studio, it's time for To Your Health with Dr. Jim Morrow. To Your Health is brought to you by Morrow Family Medicine, an award-winning primary care practice, which brings the care back to healthcare.
Hello and welcome to Your Health with Dr. Jim Morrow. I am Jim Morrow and I'm a little bit hoarse today, so if I sound like I'm old and froggy, it's only because I am. I'm very excited about the podcast today. I am, as you just heard the lady say, I'm with Morrow Family Medicine, now a member of Village Medical, and we're very excited about that. We're going to be talking about that today. And I appreciate so much anytime anybody takes their time to listen to the podcast and spend a half hour with us to hopefully learn a little bit more about either their health or their wellness or their illness or the people that are taking care of them. And that's kind of what we're going to do today. Before we get started with that, though, I want to do a little bit of an introduction. John Ray, my producer, is there at home in his luxurious home studio. John, you got on your logoed shirt. You're looking good this morning. How you doing?
I'm doing great. I hope you had a great Memorial Day weekend as we tape this show.
I did. It was fantastic over Memorial Day. I was hoarse before it, and I didn't talk much, and I was fine this morning, and now I'm hoarse again. But I'm going to be fine and get over that and get past it. Hopefully I can get enough questions asked to make this interesting today. I'm here in my horribly crowded office studio. I still don't have one like John, but I'm going to get there one day. And we've been doing this remotely now for over a year because of the pandemic, and I think it's worked out extremely well. But again, we appreciate everybody listening. The coronavirus pandemic is still a huge problem, but it is under more of what you could call, I think, control than it has been to this point. One thing that came up about the coronavirus just in the last day or two is the idea, again, that the virus is man-made and was released intentionally upon the public. If you studied anything about viruses, if you know anything about viruses, it doesn't take a whole lot of time to realize that this is just not the case. The virus, the science tells us that this virus was naturally emerged from a bat, probably through what's called a pangolin. If you haven't seen one of those, you need to Google pangolin because it's a horrible looking thing and it will definitely gross you out. You don't want to see that too many times. But it looks like it came through that and became even more contagious before coming to a human. There's some science specifics about the receptor binding domain and things like that about the virus that if you study that will tell you that this virus was not man-made. Now, I've heard people also make the argument that it could have been man-made and could have been discovered in China at some point and then taken into a lab and then released either accidentally or not from a lab. And I'm not going to comment on that because I have no knowledge. But I think it's important that people understand that everything tells us this is a natural virus, just like so many others. It is one that's going to be with us from now on. You can pretty much bet on that. So we're going to have to deal with it. And I hope people are getting better about getting immunized with the vaccine against this virus because it's a great vaccine. And I encourage everyone to do that. I know personally, I feel so much better just not having to worry so much about whether or not I'm getting COVID, whether or not every time I cough, do I have COVID, and so forth. So it's a big deal. And I hope everybody will do that. Also, if you have questions about the coronavirus or anything else that we might mention on the podcast, I would encourage you to send us an email. You can email us at toyourhealth@gmail.com, or you can tweet us. We are at toyourhealthmd on Twitter. So anybody that knows anything about Morrow Family Medicine, which, by the way, was opened 10 years ago today, knows that in the last several months, I have been acquired. The practice has been acquired by a company called Village Medical. And Village Medical is a fantastic conglomeration of people that have in mind only our patients' better health. And I'm really honored today to have Dr. Clive Fields from Houston, Texas, who is the founder of Village Medical, with us today. Clive, thank you so much for taking some time to join us for our patients today.
No, Jim, thank you very much for giving me the chance.
Well, we're very excited. I want people to be able to hear what you have to say about how this all started and what you see as being the advantages, which I think Village Medical will bring to our patient population. So a lot of people ask me how I got involved with Village Medical, and it really goes back about almost 4 years now when Village MD, the company that you and a few others started a few years ago, came to Georgia. And I was working with a group called QCPI, which is Quality Care Physicians Incorporated. And it was really a bunch of docs that got together to contract with Blue Cross and to work with Blue Cross and to improve care and reduce costs and so forth. And it was brought to my attention that Village MD, the mother company, if you will, was now in Georgia and was doing things that could really be advantageous to our patients. And I started talking to them, and it very quickly became clear that by working with them, our patients could have better outcomes and our patients could have better lives. But if you go back to the beginning, Clive, what was it that made this idea even come to you? It's just such a remarkable thing to me. How'd that happen?
So, Jim, we come from a similar place. We both started medicine or practicing medicine in small practices where there really wasn't much in the way of technology other than the landline phone that you took calls in and you sent calls out. And it's amazing how over the last 30 years of my career, that has changed. And what really happened to my practice in Houston, and I think the exact same thing that happened to your practice in Atlanta, is we realized that access to technology, understanding what happened to our patients outside of the exam room, would actually drive a different outcome because we would know more about what was happening with our patients. Unfortunately, that takes a lot of money and a lot of talent and a lot of technology, which most small practices like you and me were raised in just didn't have access to. So we realized about 7 or 8 years ago that there were lots of docs like yourself who were practicing really, really high quality medicine, doing everything they possibly could to drive the best results for their patients. But because of a variety of misaligned incentives and people in the market that maybe weren't focused on only patient outcomes, they weren't able to actually grow and expand the type of work that they did. And what we did at Village MD is we thought that bringing the technology and the capital and the talent to doctors like yourself, who were focused on primary care and delivering the kind of care that makes the biggest impact on people's lives, was an area that most people weren't focused on. I think you don't have to drive around Atlanta very, very long to see that people seem to be focused on building big buildings and putting their names on them and driving more and more care to fewer and fewer people. And what we're interested in at Village is taking care of common people with common problems in a way that they don't ever need those big buildings and big specialty care that we see in Atlanta and Houston and Chicago and pretty much every city across the country.
Well, we certainly are seeing it already and have been for the last few years. And one of the things that I think makes a big difference in that care is, well, what some people might call care management, following up on transitions of care and that kind of thing. What are you seeing as far as results with people dealing with early transition of care after either hospital stay or ER visit?
Yeah, so it's the fact that 15% of our patients over the age of 65 get readmitted back to a hospital within 30 days of a discharge is a national disgrace. And it's a shame on you and on me and the entire healthcare situation, healthcare establishment, because we've been more focused on putting people into hospitals appropriately than keeping them out of hospitals appropriately. And so what we see is we see that across the country, between 15 and 18% of all people admitted to the hospital over the age of 65 are readmitted within 30 days with the same or similar condition. Now, think about that for a second. That's 1 in 6 people who are admitted to the hospital with a diagnosis of pneumonia or emphysema or congestive heart failure are readmitted to the hospital within 30 days. What we know is the most powerful way to actually reduce those readmissions is for a patient to connect with their primary care physician as soon as possible after the day of discharge. And people say, well, why would I want to do that? It was my cardiologist who took care of me when I was in the hospital. It was my pulmonologist who took care of my pneumonia. And the bottom line is there's usually only one physician in your team of physicians who can see the entire picture, who can understand the medications that were changed and how they might impact medications that maybe that doctor didn't even know what you were taking, or can arrange for home health care to show up promptly, or for medical equipment, durable medical equipment, to be delivered on time. So at Village, one of the things that we do is we, through the use of technology, identify your patients that are in the hospital, and at every opportunity try to engage with them as soon as they have been discharged from the hospital to arrange an appropriate follow-up visit with you, their primary care physician. And what we know is if that's done well, that we can reduce those readmissions by almost 40%. And that's a number that I think we should all be striving for. It's an embarrassing situation that we even got into this in the first place. But when it comes right down to it, getting you back into your primary care doctor as soon as possible after you leave the hospital is the single biggest opportunity to not put you back in the hospital in the next 30 days.
Well, that follow-up, I think, has been one of the things that has made the biggest difference in our patients. And it's one of the things I was really amazed by when we first started working with Village, was the number of people that were involved in communicating with patients, whether it was through technology or just on that landline phone you were talking about, because a lot of times that's what it is. And I think they've already seen it. But your point about seeing the primary care doc instead of the cardiologist is a very good one, because a lot of the patients that I see are lost. The idea is lost on them as to why they would be here. And so we try to take some time to explain that to them. And I think that does make a difference. But, it's the relationship. And a lot of this just comes down to exactly that. But it's the relationship between us and that patient that's going to make it easier for them to communicate with us when they have a problem, and easier for us to communicate with them when we have a need for them to either come in or do something that we're trying to get some piece of data or that kind of thing. But it's made a huge difference for us, there's no question. But, all the hospital systems are not as eager as the others to provide some of this information to us. And that really causes a little bit of a roadblock. And it's not even a little bit of a roadblock in some ways, because if we can't get access to this list of who's been admitted, it makes it impossible, essentially, to follow up with them. So we have to find other ways to do that besides just getting straight up communication from them. And that can be very difficult. But
yeah, Jim, it's kind of been a real sore spot for me, because I think a lot of our patients believe that we actually know when they get admitted to the hospital. And we know when they see a cardiologist or a urologist or a gynecologist on the outpatient basis. But the statistics just don't bear that out, that we get reports from the specialty physicians many times less than half the time that patients are seen. And we have patients admitted to the hospital that we don't know about. And it's a real shame, because me and you both know the value of a primary care relationship, and not being able to engage with the patient at a time of really their greatest need is a disservice. So at Village, what we've done is we've tried to use as much technology as possible to capture data so that you can be aware of patients that are in the hospital, or certainly a member of your team can be made aware so they can reach out and help schedule a visit and answer appropriate questions. But it's to your point is very well taken, that I think almost everybody would say the best hospital in the country is an empty hospital, because we're all doing a good job and not getting sick. And I think once we all get on that same page and start to share information a little bit more fluidly, without all the friction that seems to come in the healthcare system, we will be doing better. We're doing better by our patients, which I honestly believe that's what we got into healthcare to do in the first place.
Right. So often the physician-patient relationship is one that in our practice, and I'm sure like yours, goes on for years and years and years. But at the very beginning of that relationship is the time when boundaries are set, when rules are set, when expectations are set on both sides, and seeing that the patient and the physician can work together to bring about a better outcome is a wonderful thing. Excuse me. But, we're still not seeing that in enough people. And I think one of the biggest problems is because I'm seeing this patient every 3 months or every 6 months. And what happens to that patient from the time they leave my office to the time they come back, whenever it might be, that's when we get in trouble. And the pandemic has shown us that we would be so much better off if we were keeping people healthy instead of trying to get them well. And clearly that's where we're trying to go. That's what we're trying to do. Everything that I spend my time doing in the exam room these days seems to be about prevention and screening and trying to get people better, get their health better so that they don't end up sick. How do you make a living, though, in this world where we've always gotten paid by insurance companies for putting out fires, and now all of a sudden things are changing?
Yeah, I mean, the good news is that insurance companies, and certainly it's hard to say this, the government through CMS is actually leading in an effort to start to compensate doctors for doing things that are right by their patients, not doing more to their patients. So if you think about it, if you come and see me on Monday and you got a cough and it doesn't get better, and you come see me on Tuesday, you got a cough, and you come see me on Thursday and it doesn't get any better, and you got a cough, I charge you 3 times. I can't think of another service where you would accept that type of outcome. I mean, if I took my car in because there was a flat tire on Monday and it was flat on Tuesday and flat on Wednesday, I would not expect to buy 3 new tires. But in healthcare, the system has been driven by what we call a fee-for-service reimbursement model, where we get paid for doing things to patients instead of what we should be paid on, which were outcomes. So if you gave me 1,000, if I was taking care of 1,000 patients and I saw them 1,000 times and none of them got any better, I'm not sure I should be paid for that work. If I take care of 1,000 patients and I go above and beyond and none of them get admitted to the hospital and they all spend more healthy days at home, then that's what I should be paid for. And what we're seeing is a change in that economic model to support what we now at Village call really proactive, team-based, and risk-stratified care. And what does that mean? That means that we have enough data now to actually predict with a high degree of accuracy who's likely to be in the hospital next year, not who was in the hospital last year. So we've got to start looking forward and not backwards. And once we identify those patients, we have to reach out before they get sick. And we have to do it not just with your time or with my time, but with a team of people who are skilled to educate those patients on how to take their medications, what type of diet or exercise might be best for them, how to best manage exacerbations of their illnesses. And if we do that, then we can start to be paid and be paid well for providing better outcomes for the people we take care of, instead of actually just being paid when they get sick.
Well, it certainly makes you feel like a better doctor, I'll tell you that, a better physician, because the whole idea for you, for me, for everybody I know that ever went into medicine was to make people's lives better. And there's no better way to do that than to prevent some of these terrible things that happened to them in the very first place. And I mentioned the relationship. I think the relationship with your primary care doctor is one of the most important things about that. But the other one is communication, because you can't have a relationship without communication. So Village and we are working on so many different things to help patients communicate. And the technology that you mentioned, I've been using electronic records since 1998 and I've been a huge proponent all over the country about them. But having patients be able to use telemedicine now because of the pandemic, it took a pandemic to get insurance and Medicare and CMS and all these people to agree that we could do telemedicine. And now that's such a huge part of medicine today. Where do you see that going? What's your opinion about telemedicine 18, 24 months from now?
Yeah, I'll tell you, I look back on the first years of my career and yours, and we were open from 9 to 5, 4.5 days a week, and you called and you made an appointment. And if there was an appointment that was convenient for you, it had to be convenient for me. And on the weekends, we weren't open, and we certainly weren't open on the evenings, and there was no way to get a hold of us other than through that old landline that we referenced. And what we know now is that was a bad decision on our part, because what it did is it really stimulated the growth of people who were a little bit more farsighted than the traditional physician. And those people recognize that consumers want to be taken care of when they want to be taken care of. And that means open on the weekends and evening hours and having physicians on call 24/7. And what we saw through the pandemic is we saw an absolute explosion in what you referenced, telehealth. Telehealth at Village Medical at one point last April of 20 was over 80% of our visits. So only 2 in 10 people were actually being seen in person. I suspect you saw similar numbers. We've certainly seen that go down as the pandemic has come to a little bit of a more controlled environment, though to your early statement, it is still absolutely at the front and center of what most physicians are doing every day. But what we see now is we see that telehealth is probably going to end up being around 20% of our visits. And people for years said, "Oh, patients don't want to see by telehealth, and once you're over the age of 50, you don't know how to use a smartphone." And I think we've shown in both of our practices that is absolutely not true. That the ability to check in with patients, to be able to actually manage simple things between scheduled in-person visits is of huge value in keeping people out of emergency rooms that they don't need to be in, or by just reducing the anxiety by being available through a different platform. I'm really excited about the commitment and the investment the Village has made to actually increase that communication through what we're going to be calling the Village Medical app. And that's an app that should be rolling out in the July-August timeframe, which seemed like a long time ago when we started it a year ago, but it's just around the corner now. But that will allow for much easier online scheduling, both in person and virtually, being able to access your provider or your physician through a telehealth portal on your phone, being able to text both synchronously or asynchronously. In other words, getting a real-time response or just sending a message in because it isn't urgent and looking for a response the next day. We're absolutely convinced that the more that patients touch a primary care physician and their team members, the better their health will be, and the less complications they will have of diseases they may not know they have, or diseases that they have that need to be managed to a different outcome.
Well, I'm so glad you mentioned the app. I wasn't 100% sure where that was and whether or not we were going to be talking about it. So I'm very excited about that. I think the idea that you can hear from patients with that sort of simplicity and that sort of ease is going to make all of our quality so much better. And I know some physicians are concerned because they're going to be getting 18 million texts and messages from patients. And I've always contended to, give me more, because I can do a better job when I have more of that information. And I'm not worried about you sending me too many because you've got a life to live as well. But if we can get that kind of information, like I said, in between these visits, we and Village in particular are going to make a difference in these people's lives. And that's why we're sitting here today.
No, I'd mentioned that the care that we deliver and the care that you've really delivered on the back of your own hard work was both proactive, risk stratified, and team-based. And I think team-based is really what's important. So if you think about 100 messages coming into your office, how many of them actually need a physician to manage? And the answer is it's a much smaller number than the total of the 100 messages. So as we put teams in place that are well-trained and responsive, we can make sure that you get an answer from the person that can give you the right answer, which may or may not be your physician, unless absolutely necessary. What that'll do is it'll allow our physicians to actually take care of more patients, though they may be seeing them personally less frequently because of the number of team members that can fill in those gaps. So as we move towards more technology and more digital communication, whether it's telehealth or what we call remote patient monitoring, having devices in people's homes that are transmitting information to us real time, so that we can get in front of disease exacerbations earlier, or simple text messaging to a doctor's nurse. And I suspect that you practice a lot like me, and that there are a number of your patients that have your cell number, and a number of your patients that have your nurse's cell number, and a number of your patients that have your office manager's cell number. And that's great, but it's not as scalable or as widely available as I think we would like it to be. So certainly with the increasing use of technology, the increasing number of ways that patients will be able to communicate with you and with your office staff, we think it's just going to drive a differentiated experience for both you and your patients. And at Village, we know that happy doctors make happy patients. And so we're going to do everything we can to make sure the team that surrounds you continues to drive the kind of work that you've really provided in your community for over a decade.
Well, I've been absolutely thrilled with the entire team. And this change has not been an easy one, as you can imagine, as you know yourself, for 10 years in this practice and 25 in others. I've always been able to, or not necessarily been able to, but have had to make those decisions and control things and take care of things, whether it was payroll or rent or healthcare insurance or whatever it might be. The fact that I can now be a physician and just be a physician alone in the exam room with my patients and have my only concern really being what's right there in front of me, I think it's already made a huge difference. I love what Village is doing. I'm excited to see what's going to come next. I'll put a little pressure on you there. I'm looking forward to what that next thing is going to be, because it seems that there's always something that's coming around the corner to improve things. I want to take a second and tell everybody we are going to be making a change with Morrow Family Medicine, a member of Village Medical, excuse me. We've been calling it that since January 1st when we struck this deal. But in July, Morrow Family Medicine will become Village Medical. And I'm very excited about that. This is a group of people that have already shown that their interest aligns very much with mine and with Dr. Kendrigan's and our mid-levels and everybody here in the office. And so we're very excited about that change. And it's going to be a big deal. Taking down the name off the buildings, not something I was looking forward to, but now I'm very excited about it because I think it just points to everything going in the right direction. I'm very excited about that.
No, I mean, Jim, we're excited too, but we also know that what happens inside the office is a lot more important than the sign on the outside of the office. Right. And we are thrilled to be able to work with you and your team and build on the reputation and the legacy that you created in your market.
And as a point to our current patients, I've told everybody that I've talked to about this, the goal is for things to run smoother and for the care to be at least as good and as communicative and as personal as it was prior. And if it ever is not that way, patients of mine, you have to know, you have to let me know that, because if you tell me it's not the way it used to be, I will fix it. And I know Dr. Clive Fields and everybody that works with and for him will help me do that. So if it's not what you expect it to be, you tell us and we will change it. So,
no, Jim, I suspect that a call to you will be shortly followed by a call to me. So we are going to do everything we can to make sure that your patients experience a better clinical situation. You made a point, and I don't know if patients really know this, the amount of work that a doctor like you puts in running your practice. And if you think about it, I mean, you're taking care of your patients from 8 to 5, but you're running your practice before 8 and after 5 o'clock every day. And the amount of time and energy just in ordering supplies and human relations and all the kinds of things that were far simpler 20 years ago than they are today, take time away from what you do best and what only you can do in your office, and that's taking care of patients. So we're thrilled to be able to take some of that administrative burden away while also expanding your access to care through teams and technology.
And it certainly has been expanded. So a lot of what we're talking about, of course, is this relationship.
I'm going to get you a doctor's appointment today, Jim.
I don't know any good ones. A lot of what we're talking about is this relationship with a family doctor. So a lot of people still today don't have one, but if you're looking for a family doctor, what's your opinion about what people need to be looking for to find that right mix for them?
You know, it's a tough question, and people have asked me that. And I would tell you, if you think about the other trusted relationships in your life, if you think about a minister or a priest or a rabbi that you've been able to establish a relationship with, if you think about a mentor at work or maybe even a teacher at one of your children's schools, there's a certain intangible in terms of that relationship, but there's a couple of real tangibles. And the tangibles are that you have to trust that that professional is competent in their area of expertise, whether that's in education or in counseling or in healthcare. But I think if you can find that, then you can actually see if the intangible is there. So that I'm going to say the table stakes are that you have to find somebody that you believe is competent. And then once you've determined that, is there a human relationship? Is there the ability to actually communicate in an open and honest way with that professional that allows you to get your needs met? And that sounds like a little bit of a soft answer, but so many people don't answer the first question before they figure out if the second question actually works. But I know that when I think about those people that I trust, whether it's personally or in family or business or religion or whatever it might be, that there's that basic table stake that this has to be a competent and skilled professional. And then I have to believe at a human level that there's a connection that I can make that will help me achieve the goals that I'm trying to achieve in whatever area that might be.
So I know we're getting up on the half hour here, but I don't want to let you get away without talking about Walgreens.
Mm-hmm.
Tell us about what's going on with Village Medical and Walgreens, because to me, this is just incredibly exciting to me.
Yeah. So about a year and a half ago, we initiated or struck a relationship with the Walgreens organization. The Walgreens organization has roughly 10,000 stores across the country, and most of those stores are at Main and Main. They're in areas that are convenient and visible and secure with free parking. And we sat down with our friends at Walgreens and we said, what is it that would actually drive a different healthcare experience for communities? And that would be bringing primary care doctors back into those communities in the kinds of sites that I just described, not sites that are in big buildings with $20 parking and an hour to get to in the middle of downtown Atlanta. Because let's be honest, if you're going to check your diabetes or follow up on your high blood pressure, you really don't need your blood pressure being raised by a parking fee that's higher than the copay you pay at the doctor's office. So when we got together with Walgreens, we said, what's the most common interaction that Americans have with the healthcare system? And the answer is, it's a visit to a primary care doctor. And then we thought, what's the most common intervention in this healthcare system? And that is actually the prescribing of a pharmaceutical product. So to be able to bring primary care and pharmacy together in a convenient place in people's neighborhoods just felt like kind of like hot dogs and apple pie, to tell you the truth. And we've been super excited about the relationship. We've now, I think opened almost 40 co-located Village Medical clinics at Walgreens. And when I say that, people think about minute clinics and they think about 300 square feet in the back of the store with 2 plastic chairs and a dusty corner. And for all of your patients who have not been in a Village Medical co-located Walgreens, I think they would be shocked about these 3,000 to 4,000 square foot offices, very functional, very modern, very clean, set up to really take care of team-based care with a high degree of technology, exactly the way that we described. And I think exactly why we started Village Medical, and I hope one of the big reasons why you joined. So we're excited about the relationship with Walgreens. We think adding the pharmacy talent of the Walgreens team to help our most complex patients manage their complicated medication regimens is going to be just super exciting and a way to really drive a different type of outcome, especially for our most complicated patients.
Well, I'm very excited about it myself, because I like the fact that it's important to the people at Village Medical to be where the people are and to bring the care to them, because that's the way this is going to happen the best, is to be where they need you to be. You mentioned all about the drive and the parking and all that, and you're right, nothing runs blood pressure up like that. But this is the kind of thing that I think could easily change things. And Clive, you're a little bit younger than I am, but I remember at the age of 3 or 5 going to my family doctor, whose office was in the drugstore. It was on the second floor right above the drugstore, but they had the kind of relationship. And we got away from that over the last 60 years. But I think getting back to that and doing something like this is just I think it shows an awful lot of forethought, and I'm excited to be part of it. And I'm excited to have you leading this entire drive, because I think no one can understand at this point where we could end up with the kind of quality that we can provide for our patients. So it means the world to me that you take the time. I know you're incredibly busy, and thanks for taking the time. I am going to ask you to stay with us a few minutes, because I think John Ray has accumulated some questions from folks that he might want to have me or you, or probably you, answer. John, what you got up there, John?
Yeah, let me pass a couple things along. So, Dr. Fields, speaking of convenience of access to care, telehealth. What do you see happening with telehealth? Reimbursement's an issue, of course, with that, and what's going to happen with that. But how do you see telehealth coming out of the pandemic?
Yeah, so let's be clear about what telehealth is not. Telehealth is not a replacement for a trusted relationship with your family doc. That it is not. It is an adjunct. It's a way for your family physician or your primary care physician to reach out to you in a more convenient way. I see lots of ads on TV now for organizations that believe that they can replace physicians with technology. I honestly believe that is a failed strategy, and that technology should be used to augment the physician relationship that you have, not to replace it. I think telehealth and a lot of the other technologies that are coming out of this pandemic are here for the long haul. They're not for everybody, but they are for a lot of people. And what it does is it allows those additional touch points with patients who may need a little bit of a nudge or a little bit of an education, or a question answered in a really convenient way. I mean, if you think about it, gosh, I flew from California to Houston yesterday, and I scheduled my reservation on my United app, and then it popped up in my calendar, and it reminded me 15 minutes earlier to make sure that I was there on time. And I think we're going to get that kind of technology in healthcare. We've been woefully behind for a long time, and I think telehealth is going to be here for a while. And I think more and more patients are going to continue to get comfortable with it. As we get paid differently, as physicians get paid for outcomes instead of volume, we want to use every possible way to actually improve a patient's access and healthcare results. And telehealth is going to be part of that suite of services.
One more question, and really this is, I think, for both of you. It comes from y'all talked a lot about the advantages of technology and scale in being able to spread that technology over a lot of different practices and locations. Let's talk about a problem around the problem of talent acquisition, because it seems like that there's a shortage of great talent across a lot of different industries. I'm wondering how that impacts y'all, and I guess just the ability to be able to attract the kind of people you want to be able to grow, and how that really affiliating with Village helps all your practices be able to attract the people that you need to grow.
Well, I think from my standpoint, attracting and finding providers, physicians, PAs, nurse practitioners that are wanting to do the kind of practice, the kind of medicine that we're practicing is not that easy, just because we ask an awful lot of them. We ask a lot of our providers as far as what they're doing, as far as taking care of people, and frankly, and sometimes volume, and always being in great detail what they're doing. But the advantage with Village is that there's a huge attraction to being able to be supported by the type of people that Village brings to the table. Because the people that Village brings to the table is what obviously already has made a difference for us. And I think anybody that wants to practice good medicine realizes that it takes that, especially today. And so I think that alone is going to make it easier for us to attract the kind of people that we're looking for here at Village Medical and Cumming and Milton.
Yeah, John. So I'll take it like a kind of a level up and say that in healthcare, we're incredibly fortunate to still attract mission-driven people. And that people, lots of smart people who have the choice to work for banks or for real estate companies, opt to work in healthcare because they want to make a difference. And being able to attract those people is absolutely key to the success of Village, the success of Dr. Morrow's practice. And we're fortunate that there is an entire generation of young people that sometimes gets a little short script. But they shouldn't, because there's lots of mission-driven folks, and they want to make a difference. And healthcare is a place that I know that we hope to give them the opportunity to do that.
Awesome. Now, one final quick question for Dr. Fields. How do you feel about Clemson football?
So I'm a University of Texas guy, and I'll be honest. The good news is we haven't had to play Clemson in a while, and that would have been an ugly Saturday in Austin, that's for sure. So until they're back on the schedule, happy to root for the Tigers.
Sounds like
coming, and so is football. So that's always good.
Absolutely,
it's always good. Well, Dr. Fields, thank you so much for the time and the information and for your guidance in this entire process. I can't thank you enough. I look forward to seeing what we can do together with Village Medical going through 2021 and hopefully the next many years. So thank you so much for joining us today.
Jim, thank you very much for the opportunity.
Oh, yes, sir. And so for now, that is To Your Health.